mention later, but it is just more of a sharing experience. So I assume that everyone in this room would know what is this Dunning-Kruger curve, right? It is about our confidence levels in relationship to knowledge and also skills in the field. So this is actually my own Dunning-Kruger curve in periorbital rejuvenation, where I actually hit the Mount of Stupid at year 3, where I thought that everything could be solved with just tear trough fillers. Boy, was I wrong, and I had an eye-opening experience, and slowly now, more than 10 years in this industry, I realized that there's a lot to learn, and today we learn from all the wonderful speakers as well, and there's still more things to learn. And just a few weeks ago, this kind of article came out, and it got me thinking, because the buzz is like, is this Tyndall? Is this migration? Is this poorly done? But Jennifer Aniston is a Hollywood star, and I'm sure she has the access to all the wonderful or great surgeons. So I wonder, like, I'm sure these are all experienced injectors, and what could go wrong? So in terms of that, I think about the periorbital region again, and how does someone go from this to that? It's because of the multiple layers that come into play. So we know that it's about the skin, the fat pads, muscle, and also the bone. And because there's multiple layers involved, we also as practitioners need to ensure that we have multiple tools to assist us. So yes, I do still use fillers, especially when there is tissue volume loss and also any bone resorption. However, you have to think of what is the other aspect, which is the skin, and how we can improve skin quality. And also in terms of muscle, we know that neuromodulators will also assist, and again, the fat pads. So what I would like to share are the 3 treatments that we can use in the practice that will address the skin quality. So these are the top 3 treatments that we usually use. With skin laxity and also mild volume loss, we use the Juvederm Bolide and also Profilo. And for skin laxity and discoloration, I use polynucleotides Pinus Fast from Masterly Aesthetics. So for this treatment, normally it can be for 2 types of patients. One is those who are already doing fillers, and you can see that there is only a certain amount that will ensure the periorbital area is rejuvenated. However, to avoid from overfilled syndrome, we must make sure that we choose other modalities as well. There's also another patient group of ours which they do not want any fillers at all, and they want something supple and natural, and these are also some of our go-to treatments. So first, let's go into periorbital rejuvenation with the skin laxity and mild volume loss. The first one is Juvederm Bolide. It is actually indicated for skin quality treatment, and the formulation is actually 12 milligrams of HA per ml. It comes with lignocaine as well, and also is part of the Vicross technology. So in terms of the technique that we can use, we can just inject microaliquot into the tear trough itself. So it's actually subdermal and at the subcutaneous layer. It's a very subtle lifting effect and also fine lines. And these are the kind of results that you can expect with Juvederm Bolide. So you will not be able to see a full tear trough filling effect, but a mild sort of rejuvenation. And it is also good for fine lines as well when it comes to static wrinkles. So the good thing about it is that it is just one single session, and it can last anywhere between 6 to 9 months. However, the downside is that we need to do microaliquot technique, and with that, of course, the risk of bruising is there, and when it bruise, usually it will last anywhere between 7 to 14 days. So the next product that we use in our clinic is the Profilo. So I'm sure we know that Profilo has been around for a very long time, and in Malaysia it was introduced in March 2020. What is it? It's actually not a cross-linked HA as opposed to just now the Juvederm Bolide. Profilo is a thermally stabilized hyaluronic acid, and it's a combination of high molecular weight and also low molecular weight, which is 64 milligrams in 2 mils. So why do we use it is because we know that it works in the epidermis and also the dermis by stimulating collagen type 1, 3, 4, and 7. And there has been clinical studies published on adipocyte stem cell differentiation as well. And that is where the Profilo for periorbital came into play. So it was initially started as skin quality treatment, which is the mid-face area. And just recently, they developed Profilo 2.0, which is the periorbital technique. And this is an off-label indication at the moment. So how do we inject? If you see the green marking, that is for the subcutaneous area, and the purple dots actually for the SUF area, and the yellow one is at the temple. So in one box there's 2 mils, you will divide it into 1 mil per side, and you will use 0.5 at the periorbital area and another 0.5 at the temple area. How we distribute the product is 0.3 will be at the SUF layer and 0.2 will be at the subcutaneous. So how do we do it? We know that the Profilo is actually just pure HA. There's no lignocaine at all. So to make your patients more comfortable, we can give a regional block of infraorbital nerve and also zygomaticofacial nerve. So how you do it is that you can use 1 or 2% of lignocaine. You ensure that you mark at the medial limbus and get the infraorbital foramen and also the zygomaticofacial foramen. And you will deliver 0.2 mils of anesthesia of lignocaine at each point. And then at the entry point as well, you can also deliver the lignocaine, which is just 0.1 to 0.2 mils, and that should be sufficient enough for the patient to feel comfortable. So then you use a 23 gauge needle as the introducer, and you can use, in our practice, we use a lot of 25 gauge cannula, and depends whether you want to use 40 mm or 50 mm. So the first plane of injection, we will go at the SUF layer, so to make sure that it is deeper than the orbicularis oculi muscle, and we will deliver 0.1. If you see the dots, it will be 0.1, 0.1, 0.1. And then we move the cannula upwards, and we will change the plane to the superficial part, so the subcutaneous area. So how we know that is that when we tent it up, you can see the cannula. And here, this area, you can deliver 0.1 with panning technique. And then you go to the lateral part of the periorbital to deliver another 0.1 fanning technique as well. So these are the kind of results that you can get with the Profilo. And if you see, it is just a very subtle volumization, and the laxity of the skin is much more improved. And usually for these patients, I would choose maybe between the age of 30